Good afternoon, everyone. Thank you for coming along to our public health COVID-19 Zoom call to give our residents across Havering an opportunity to come together to hear from the professionals that work for both the council, the CCG and the NHS to try to get those messages out, to answer any questions you may have and be able to try to create a positive view about what's happening locally. I'm Councillor Dave White, I'm leader of the council, so by way of introduction, just wanted to spend a couple of moments to say what the purpose of this event is, and then I'll hand over to Councillor Jason Frost, who's the cabinet member, who's the councillor responsible for public health from Havering Council. So part of this session is to answer any questions you may have, also to outline what the council's doing to support the good work, brilliant work of that's been undertaken by the NHS and colleagues to support, first of all, to keep us safe, but also to support the vaccination rollout that's happening at the moment. I've been overwhelmed by the vast majority of residents across Havering that are incredibly appreciative of everything that's been done to keep us safe. But unfortunately, there is a small group of individuals that wish to peddle fear, fake news, or try to feed on distrust and trying to spread rumour about the safety of the vaccination programme that's being rolled out. So this event is trying to dispel some myths and to give some reassurances to everyone across our community. As part of that, our council has launched a communications campaign entitled Better Days Ahead. And the idea is that hopefully we'll soon reach a point where we will be beyond COVID. I think that's something that we can all look forward to. But it's important that for people to have that faith and confidence in the vaccination rollout and the vaccine itself, that they hear from trusted community voices that the vaccine is safe, and it's something that they should sort of take up when they're off from the NHS. So it's not just people like myself or Jason or NHS colleagues, but we're aiming to try to go into all of our respective communities and get those individuals that people respect within the localities to endorse the vaccine and the vaccination rollout, to try to encourage as much of the highest possible take up as possible. And I think that's the right thing for us to do as a council and as a community, so that we can ensure that we can do everything possible to support the NHS at this difficult time. I'd like to just hand over to Councillor Jason Frost, who will go through the housekeeping and introduce all the panel members. So thank you.
Thank you, Councillor White. Yes, thank you everybody for attending today. This is one of only a few of these sessions that we've started to trial, and we think it's a very good way, given the circumstances, to at least allow for a public forum of some form to take place. And we hope it's going to be a good session today. Before I introduce the panel, I will, as chair of the meeting, I will take everyone through the housekeeping rules. Firstly, just to let everyone know, this session is being recorded. It's being recorded for the purposes that for communications purposes. It will be uploaded onto our website, so other residents who were unable to make the session can benefit from the discussion. Secondly, everyone attending will be asked to keep their microphones on mute, unless a question is directed to them or they need to add an answer. Everyone will be asked to have their cameras on for the duration of the session. If you do have any questions, please use the chat function of the Zoom platform, and the moderators on the who are assisting on the call will direct the questions to my attention. Any general questions will be answered by the moderators in the chat box, and they may also signpost you to the appropriate information provided by our partner organisations. Any abusive trolling comments will be muted and asked to stop. Repeat offenders will be removed from the call. Okay. Right, well, I'm delighted to introduce on our panel today, we have Dr. Mark Ansell, who is the Havering Council's Director of Public Health, who will be assisted by our Public Health Consultant, Viv Cleary. We have Dr. Magnus Smith, who is the Chief Medical Officer at BHRUT, and Dr. Atul Agarwal, who is the Chair of Havering Clinical Commissioning Group. So I will begin the session by handing over, excuse me, I will begin the session by handing over to Dr. Mark Ansell, who will give the latest update on what is being done to tackle COVID-19 in Havering. Dr. Mark Ansell, please.
Thanks, Jason. Hello, everyone. I think I've just been asked to give a little bit of context before we get to the meat of the webinar. I thought I'd start with just giving an idea of where we are in terms of the pandemic in Havering. I think, as you're probably all aware, rates of infection in Havering reached very high levels in the run-up to Christmas and into the new year as a result of the new, more transmissible variant of coronavirus. I'm sure our experience and that of other boroughs in northeast London and surrounding parts of Essex was part of the evidence that persuaded government to trigger the current lockdown. Because without lockdown, I think there was a very real prospect that NHS services would have been overwhelmed. Rates are now coming down, but are still high. Our hospitals remain full, particularly intensive care, caring for the most seriously unwell. And I would like to thank Magda and Atul for joining us. I'm sure they and all health and social care colleagues will have been working under enormous pressure for many weeks and will continue to do so for many more, unfortunately. I think despite their best efforts, death rates from COVID in Havering are as high as they were at the first peak and are likely to remain high for a few weeks more. So, in terms of the whole pandemic, more than 700 residents have died following COVID infection. It's a very stark figure. As I said, rates of infection are now coming down as a result of lockdown, and your collective efforts in complying with lockdown. And the council has and continues to do everything it can to contribute to that collective effort to control COVID in any way we can. So public protection colleagues have and continue to inspect businesses in the borough to ensure that they're COVID secure. And we've got the COVID marshals who are out on the street encouraging everyone to comply with, first the tiers and now the lockdown. And the huge majority of residents continue to do that. We assist care homes, schools, businesses in the borough when they have outbreaks of infection, and we advise and support them to bring those outbreaks into control. We're working with NHS Test and Trace to give residents convenient access to testing, both the PCR tests that go off to the laboratory and the newer lateral flow devices that give a result in 30 minutes, which we're now rolling out to 5 of our libraries in the hope that residents who can't work from home will be tested regularly to make sure that we pick up asymptomatic cases of COVID as soon as possible. We also work with NHS Test and Trace on contact tracing, including doorstep visits when people who've tested positive can't be contacted by any other means. And despite that huge increase in cases in the run-up to Christmas, Havering continued to be one of the best performing areas in London, and we reach close to 100% of all cases, which is a huge effort and great performance. We offer support to residents who then need to isolate, including financial support to those who are faced with financial hardship. And we put them in contact with our voluntary sector partners who have been, huge assistance throughout the last 10, 11 months. And, particularly that support with clinically extremely vulnerable residents who need that additional, care and protection and that throughout. And I suppose most recently, and getting on to the substance of today, we've been working with NHS partners to offer vaccination to residents by making the Hornchurch Library available as a vaccination site. And we've launched our sort of comms programme better days are ahead to promote a vaccination. So I think, we know, and I know there are many people who just want to know when and how they're going to get the vaccine, but others who have concerns, which we hope to answer over the coming weeks, so that ultimately the huge majority of residents will make an informed decision to be vaccinated. And this webinar is the start of that process. So I think at that point, I'm going to hand over to Magda, I believe.
Good afternoon, everybody. And can I just say that from an NHS and an acute trust perspective, thank you for everything that you are doing to help get COVID under control. I think we came through the first wave last spring, and I don't think that we anticipated that we would get a second wave that was as bad as the first. And certainly coming into September and October, we started seeing a rise in the number of people who were coming into hospital with COVID. And then that rise suddenly went up, and that was with this new variant, which is much more infectious. And the differences between the first wave and the second wave have been that we have seen as many people coming into our hospitals, and probably more in our intensive care units. But we learnt things in the first wave about how to treat people. We had drug trials that told us what drug was the best one to give to people to try and help people get better. But actually, that's never going to be good enough. And the only way I think that we are going to get through this COVID pandemic is by preventing people from getting sick with COVID. And as a result of which, this vaccination program is absolutely critical to helping us get our lives back on track. As Mark said, we are still very busy at the hospitals, but we are slightly less busy than we were over the Christmas and New Year period when we were incredibly busy, sadly, with patients coming in with COVID. So why is a vaccine so important? And I think we're very lucky in the UK, actually. We've all grown up with vaccination programs. We vaccinate against tuberculosis. We vaccinate against measles, mumps and rubella. We vaccinate against hepatitis B where appropriate. And internationally, we vaccinated smallpox into oblivion. We've got rid of polio across most of the world. So vaccines are absolutely critical to how we control very infectious diseases, and diseases which can have really, really serious effects on people's lives. And the thing about COVID is it's not only the high number of deaths, which we have very, very sadly seen, not only in the UK, but also locally. And I believe that COVID has probably touched every household in one way or another over the first and second wave periods. But also the impact of having COVID isn't just your acute episode. So some people will just have a mild flu illness, but other people end up in hospital on our intensive care units. But people who are recovering are still seeing the impact of COVID in their lives, which can go on for some months, and that's called long COVID, which we now recognise as an effect of having COVID. So we need to prevent this happening, and we need to prevent it happening by using vaccines. And just in a very simple way, the thing about COVID is it's a brand new virus to our bodies. So our bodies don't know what's coming, and they don't know how to respond to it. And so the body, when it sees a new infection, just goes all out to try and get rid of that infection. And it throws everything from its immune system at it to try and kill the infection off. But unfortunately, that can have additional effects on the body, and sometimes the actual reaction to the infection can be overwhelming. So it's much, much better to have the body prepared for this foreign visitor and be able to recognise when it comes through the door that this is a nasty stranger, and to be able to get the weapons out really, really early and direct the weapons very specifically at the virus. And that's what a vaccine does. It takes a tiny bit of information from the virus, introduces it into the body with as the vaccine, the body recognizes that bit of the virus, starts to make antibodies and create memory about that virus, so that when that virus comes knocking, the body says, I know about you, and I can target you, and I can get rid of you. And that's the point of the vaccine, and that's why we're pushing so hard to get the vaccine. And I think, you know, at the moment, in the local area, we are using 2 types of vaccine, although 3 have been licensed for use in the UK. So if you're having your vaccine in the hospital, and that's mostly care workers, hospital staff, ambulance services, frontline people, plus a few very, very high-risk patients. If you're having the vaccine at the hospital, you're more likely to have the Pfizer vaccine. If you're having the vaccine in the community, you're more likely to have the Astra-Oxford vaccine. And that's just because the way you have to look after the 2 different vaccines before you can give them. The Pfizer vaccine, you can't move around. The Astra vaccine, you can move around and transport into care homes, into people's homes, and give it locally. They have the same impact. They both vaccinate against the current variants of the virus that we're seeing. They're just designed in slightly different ways, but the principle is the same. Teach the body to recognize a bit of the virus. And that bit of the virus is something called the spike protein, which is how it gets into cells. So that's how the vaccine works. We know that even after the first dose, give it a couple of weeks and there's really good levels of immunity. And because of that, the Joint Committee on Vaccines and Immunisation, which is a national expert committee, has said we need to get the first dose into as many people as we possibly can and as fast as we possibly can. So let's get everybody their first dose, even if it means delaying the second dose a little bit. We believe this is the best thing to do. And I would say that I know that, you know, there are concerns about the delays around the second dose, but actually in the UK, we are now over 6 million people, I believe, vaccinated, and probably Mark or Viv may be able to tell me it's even more than that now. That is way more than any other European country, way, way more. So I think that this approach is actually getting as many people as possible, at least with their first dose, and then we can start looking at giving people second doses. I think Atul will explain the sort of details about where the vaccines are being given and the rollout across the community. But I would say that it's a jab in the arm. We check and make sure you're okay to have it. We give you an injection in your arm, a little bit like the flu vaccine, and then afterwards, some people will get a small reaction to the vaccine, so that's not uncommon. Certainly to get a bit of soreness in the arm, a bit of redness at the injection site. A few people will then have maybe a headache, feel tired for a few days. Some people will have a fever for 2 or 3 days afterwards, but it all goes away. And that is not because we've given you the virus, it's because your body is building up its reaction to future virus infections. Serious complications are really, really rare. And the most reported one is that of an anaphylactic or severe allergic reaction to the vaccine. And it's because of some of the chemicals that are sat in with the vaccine. And so we do check if you've had a history of very severe allergic reactions, your doctor will check with you to make sure that it's okay to give you the vaccine, and may choose to give the AstraZeneca vaccine rather than the Pfizer vaccine, for example, to some people. It's very clear that there are a lot of conversations going on about concerns about the vaccine, and we hope we can address those this afternoon. But one of the things particularly is that these vaccines do not contain animal products. They don't contain human products in terms of fetal cells, etc., etc. Although one of the vaccines is based on something called messenger RNA, that's part of the messenger RNA is like a recipe, delivering the recipe for the virus to the cells. But it doesn't stay around. Messenger RNA basically gets destroyed once it's fulfilled its function. The vaccines have been developed very, very rapidly, but that's because we've invested huge resource in their development and have run a lot of the processes that normally people would do one bit and then another bit and another bit, and we've run a lot of the processes in parallel to enable the vaccines to be rolled out rapidly. And before they came into public use, they had been tested in thousands and thousands of people, and now millions have had them. And I think I'm probably going to stop there.
I was going to say, Magda, could I just hold you there, because we do want to allow as much room as possible, time as possible for questions, and I know you have to leave a little early. So if we could turn quickly to Atul now, just to give an update on the community programme.
Good afternoon, everyone. And again, my thanks to everyone in the community who's helped to curtail this awful infection, and for all the help you've offered the NHS in terms of accessing the NHS when it's appropriate. In terms of the COVID vaccine, at the moment in Havering, we have two main sites. The first site is Victoria Hospital, and the other site is Hornchurch Library. And those sites have been designed by, if you like, geographical areas. Your primary care GP practices have worked together in something called PCNs, primary care networks, and those networks have allocated themselves a particular site, which hopefully is close to your home. And so therefore we have two sites. At these sites, we receive vaccine and we are notified about which vaccine we're about to receive. So on a different day, we might get the AstraZeneca, which is one of the vaccines, and the Pfizer, which is another vaccine, on different days. And we might get different quantities as well. Now, what we do have is something called mutual aid with our colleagues in Barking, Dagenham and Redbridge, which means that if we feel we need more vaccine and they've covered a certain cohort of patients, with permission, we are able to transfer the vaccine to us or vice versa. And what we need to do, though, is work through those first 4 cohorts of patients that we've been asked to do. So as you all know, they're the over 80s, the care homes, and 70s now, including those who are extremely vulnerable. So they're the first 4 cohorts that we need to achieve. And our target date to get those done is mid-February, on Valentine's Day, actually, on mid-February. So that's the program. How you're invited, there's 2 routes of being invited. First of all, your general practice may invite you for a vaccine, and you may receive a phone call, a letter or a text. And the other is a national-led program, which also has the mass vaccination program site, which is the EdXL. You can reject EdXL and wait to have your vaccine done at the local centre. We do have housebound patients as well, and we're just working our way through those at the moment. Thank you, Councillor Frost.
Thank you very much, Atul. Beg your pardon there. And thank you to Mark and Magda as well for providing those updates. We are now beginning to receive some questions. Our moderators are doing our best to sort of group them so we cover as many off as we can at a time. I've also had a number of pre-submitted questions, which in the interest of fairness, I will try and take ahead of questions that have just been submitted, but some of them do overlap. We have a question. Magda, I think you would like to address this. I know this has been an issue that has come up at the hospital. The question reads, I'm due to receive my vaccine next month due to an underlying health condition. However, I'm also a woman of childbearing age and keen to look to start a family in the next year or so. I've been doing my research into the effects on pregnancy, but I'm still concerned. How safe would it be for me to get vaccinated? Do I selfishly put my own health and life first, or am I risking the future health of any unborn child? I know fertility and vaccination, as I said, has come up as a concern. I know it's been expressed to you within the hospital setting. So did you want to talk to that, Magda?
Absolutely. So I think just very clearly, there is no evidence or reason why this vaccine should affect fertility. There were some original, concerns which became rumours, which is that the vaccine can affect people becoming pregnant, but there is absolutely no evidence that it can do so. There's something about the protein that sits on the side of the vaccine, of the virus that we target the vaccine at, which is similar but not the same as a protein that would be in the placenta, which is obviously where the baby attaches to the womb. But the body recognizes the difference and will not affect the placenta. So there is absolutely no evidence that the vaccine affects fertility. I think that's presumably that answers your question, I think, Councillor Frost.
Thank you, Magda.
And that's ratified by our fertility experts as well.
Thank you, Magda, for that comprehensive response. I have 2 more questions. I believe, Atul, you may wish to take these ones. Firstly, on the assistance for elderly residents getting vaccinated, why are they being sent out of the borough? And do we have records of housebound patients that we can visit and deliver vaccines, that can be visited and the vaccines delivered in their home, in their domestic setting, saving them from having to travel?
So first thing is, do we have a list of housebound patients? Yes, we do. And if we've missed anyone, just to inform your practice, your GP practice, so that we have a more comprehensive list. So in my own practice, I know there's 36 housebound patients. Assistance, none at the moment. Mark Ansell might know of anything different. I know up in some of the London CCGs that they had taxis bringing patients to some of the vaccination centres. We don't have that at the moment. There may be volunteer service that can do that, but that's something we are discussing at the Health and Wellbeing Board.
Thank you. Sorry, Mark, did you wish to come in there as well?
Well, just in terms of taxis, I believe there is a taxi company across London that has offered free transport to people who want to get to a vaccination appointment. So I can dig out details of that if that would help.
Yes, I think that information would be most helpfully disseminated. Maybe we can include something in our next public communication. Thank you, Mark. Right, our next question, what measures are in place to keep vaccine sites safe? I know that similarly to the concerns we've had around patients having to visit the hospital settings, I think individuals there have been some concerns about the vaccine security or the COVID security of some of our vaccination centres. Atul or Mark, to whom would like to take this question?
I would, well, I don't have specific insight about the IPC arrangements that were put in place when the sites were set up. Atul may or may not be able to comment on that, but certainly, you know, public protection colleagues would be available to support if that was, you know, seen to be helpful. But all of the vaccine sites across the country will have been set up consistent with very detailed SOPs, standard operating protocols, which tell each, you know, every site is being organised in exactly the same way to ensure that sort of COVID security, IPC, making sure that social distancing is maintained throughout. So they will all operate in line with that national SOP.
Thank you, Mark. Atul, did you wish to add to that?
So I'm not sure if there's 2 parts. So before the sites were set up, there were police visits to the site to make sure all sites were secure in terms of confirming that CCTVs and etc. were made secure. In terms of clinically making sure the sites are safe, we do have to follow certain protocols of social distancing. Sometimes that gets difficult if we get a large number of influx of patients, some turning up earlier, later for appointments. as well. And if we've got a slight slowness in giving the vaccination, obviously making sure everyone has got mask cleaning, the site is clean, the 15-minute wait, etc. for one particular vaccine. So we follow a strict line of regulations that we have to follow at each of the sites. And that includes the storage of the vaccine, the diluting of the vaccine, and even the administrating of the vaccine. So all of those are done by a certain rule across the whole of England.
Thank you, Atul. Turning next, we had a pre-submitted question, but I believe it's also come up in the chat about this is about the points of entry. There's been some confusion that's been given by residents receiving letters from the national scheme, which permit them only to visit certain sites. Did Atul, did you wish to address that point? Thank you.
So the national scheme will direct you to usually the mass vaccination centre, which is the EdXL, or also give you the number, and I'm going to say the number wrong now, I can sense this, 119, I have a tendency of saying 911, by the way, 119, which allows you to book your appointment at the site. Now, like I said, you do not have to go to the EdXL centre, which is our nearest mass vaccination centre. You can wait for your local practice, PCN, to make contact with you.
And Atul, just a follow-up question to that. By and large, unless they choose to take up that option of going out of borough, the choices will always be one of the two centres that are currently operating in Havering.
Yeah, absolutely. One of the things to remember at the moment also is at present, and this could change as things do change, wherever you have your first vaccine, you are deemed to be going back for your second vaccine to the same site. So please bear that in mind as well. That's at present. That may change because, you know, I appreciate we've got an elderly population and they may not wish to travel to the EdXL in 12 weeks' time, but that may change.
Thank you, Atul. We have a question here from Justin. Has the virus been trialled on immunosuppressed patients? Dr. Magda Smith?
Yes, so the vaccine has been given to immunosuppressed patients, obviously immunosuppressed patients are much more vulnerable if they get COVID-19. And so the recommendation is that those who are immunosuppressed fall into the clinically extremely vulnerable group who are being called for vaccination. That's recommended by a number of specialist societies. So certainly websites for national specialist societies. So my own specialty is a condition called inflammatory bowel disease. I have a lot of patients who are on immunosuppression drugs, and the recommendation to my patients is that they should get the vaccine. What we don't have detailed information of is whether the protection that the vaccine gives is as good as somebody who is not immunosuppressed. But given the risks of this virus, it is still recommended to have it.
Thank you, Magda. We've had a couple of questions in relation to the status of carers in an unpaid capacity. I shall, in the interest of fairness, I'll read the pre-submitted question. My son will be having his vaccine on Sunday as part of the clinically extremely vulnerable group. He has Duchenne muscular dystrophy. I do apologise if I've mispronounced that, which seriously affects his breathing and obviously needs a lot of help. Currently, as his unpaid carer, I don't seem to be entitled to the vaccine straight away, which will still make him very vulnerable. I'd like to know why other carers have already had the vaccine and those of us that live in the same house as those that have a serious condition are not being given the vaccine immediately. Dr. Ansell?
I was hoping that that would go to Atul, to be honest. I think my understanding of the JCVI categories is that the carers of people who are clinically extremely vulnerable can be considered as part of that cohort. But it is I believe it is a decision that the GP may make. So I think GPs may have a little bit of discretion, which is partly why I was hoping that Atul may or may not be able to confirm that. But that's my understanding of the guidance that goes with the JCVI categories.
Okay, well, on the strength of that, I will bring Atul in here. He may wish to add to what you said.
Apologies, Atul. For
Yes, Mark, thank you. I'm sure I'll find a question for you.
Thank you.
Okay, so I think in everything that is written never covers all eventualities. So I'm aware that about the carers in the Joint Committee for Vaccination and Immunisation. I think we need to be really quite pragmatic about this. You know, if I see an 80-year-old in the beginning and their partner or spouse was 76, 77, you would not send the husband and wife home and say, come back in 2 months and we'll vaccinate. You'd vaccinate both. And that's what we were doing. And I think, you know, you've got someone who's extremely vulnerable here. You've got a carer who's the main carer, unpaid. So obviously spending all their time, it would be nonsense not to vaccinate. And I think it just takes common sense.
Thank you, Atul. I've got a question on concern about scams surrounding the vaccination programme, but I will take a few questions from the pre-submitted list first. How does Havering rank against other London boroughs for the number of vaccinations given per 100,000? How many vaccinations are being carried out each day, and what times are the centres open, and how many so far? And what is the council doing to ensure Havering is receiving the same number of vaccine doses as the proportion of the population compared to other boroughs? Dr. Ansell, did you wish to take this question?
I will start in that the available the information we have isn't available at borough level, so we can't make comparisons between boroughs. I think the commitment that our NHS partners have made very explicitly is that the deadline to immunise the first 4 categories, which is down to residents aged 70 and above, will be met on the 14th of February, as Atul said. So, you know, in terms of relative rates of progress towards that target, I'm unable to comment, but we have had a very definite commitment that that target will be met on the 14th.
Did either Magda or Atul wish to come in about concerns that have been expressed about supply overall?
So absolutely, I mean, there will be reports, news reports about the changes in supply of particularly the Pfizer vaccine as the factory is refurbished, for want of a better word, in order to get its productivity up. We are still confident around the supplies for first dose vaccines, and that will then be worked through, and that will then enable us to give second doses by the 12 weeks. So at the moment, whilst there are concerns, it's being tracked very, very closely. And obviously, this is a national programme. This is not about local purchase of the vaccines. And actually, the vaccines belong to the national team and are being distributed. And I think it's interesting. I saw something in the chat about wastage of the vaccines. And I certainly know from our perspective, there is absolutely zero wastage. And we do have reserve queues, if you like, of people to come should there be a no-show for an appointment, for example. And that's really important, that we don't waste this very, very precious resource.
Thank you, Magda. Did you wish to add anything at all?
So vaccines The issue with vaccine and giving times is sometimes you're not sure what time the vaccine is going to arrive. You sometimes get told the vaccine is going to arrive on Thursday. Now we know that once we open a vial, we've got so many hours to use that vial in. So you then regulate the timing of your clinic based on when you open the vial. You've got 6 hours to use that vial. And that vial has 975 doses in it. So sometimes you end up changing the time of the clinic because the vaccine arrives at a certain time. This is called a push model. The vaccine is sent to us as opposed to something called a pull model, where we can request how many vaccines we require. So the other thing that is really important here is that we recognize that our borough has the large certain age group, while one of our neighbouring boroughs, and I'll say Barking and Dagenham, may have less older people. So what we do is this mutual aid, which I explained earlier, that if we feel that they've done their 70 plus or a certain age group, and they feel they can't run a clinic, there is the probability and possibility of bringing a vaccine from another borough to ours. And we've done that this week, actually.
Thank you, Atul. I was going to take the question on spam, but or on the vaccination scams, but I will hold that just because I know Dr. Magda Smith has to leave a little early. We have a question here on, are there any known allergic reactions relating to allergy to aspirin or ibuprofen?
No, none to aspirin or ibuprofen or any of the anticoagulation tablets. The only one with Pfizer is to make sure that the INR, if you're on warfarin, is below 4.
Thank you, Atul. Magda, we can't seem to hear you.
Oh, sorry, can you hear me now?
Yes, we can hear you now.
Apologies for that. Yeah, I was just going to say absolutely aspirin, ibuprofen are absolutely fine. And the reasons for being making sure that your blood thinning is at the right level with warfarin is purely because we are giving this vaccine into a muscle. And obviously bleeding, we don't want any bleeding, but otherwise it's absolutely fine. And if you're on any other form of blood thinning medicine, it's fine.
Thank you, Magda. Okay, so a question now from Julie Wedge. There are already a lot of fake email, telephone calls, text messages going around. How are you contacted to go through the process of gaining a vaccine? Mark, did you wish to take this one?
I'm afraid I couldn't advise on how you tell that it's a bona fide communication from the NHS. I think it is a great question, and depending on whether possibly Atul is able to answer, we could maybe put it on our FAQs on the council website so that we do have a definitive answer. But I know I appreciate how important it is people know that it is a bona fide sort of communication, and we'll make that very clear on our comms.
Thank you, Mark. Atul, did you wish to add to that?
Councillor Frost, I really can't answer to that, to be honest. The only thing I would suggest is we put copies of fake communications on a website so people can compare it. But these individuals are very clever indeed.
Well, and I think the important thing is if there is any concern that it is alert, attempts are made to alert ourselves in the local authority or your own medical practitioner, and just to establish whether they have received, if it is a scam correspondence. We've had a question regarding reactions. I had a very bad reaction to chemo, needing oxygen, antihistamines, etc. Is the vaccine safe for me, and are oxygen drugs available at the library if needed? I'm assuming that means at the tests or the vaccination centre. I will direct this to Atul.
Somehow I had a feeling that was coming to me. Okay. So first thing, is oxygen available at the sites? Yes. As we said earlier, there are certain things that must be available at all sites, and that includes an ability, in the rarest chance that someone has what's known as an anaphylaxis shock, which is a severe reaction, to give them oxygen, adrenaline, and first aid. So in every single site, that is available. The question you raised about a reaction, if you have a reaction that requires you to take adrenaline, then the Pfizer vaccine is not the one for you. One could use the alternative, which is the AstraZeneca. I will ask Magda to clarify that in case I said something different.
No, I absolutely agree. And I think that this is one of these things that you need to speak to your doctor about. But basically, the general advice is, if you've had a severe reaction, such as one you've described, to a previous vaccine, that would lead us to give you the Astra vaccine rather than the Pfizer vaccine. If it's a chemotherapy related drug reaction, it's less likely to be an issue. But absolutely, you must tell them, or tell your GP, and also tell them at the vaccine centre, and they will know what is the right advice to give you, because this needs to be personally reviewed.
And
Councillor Frost, I'm sorry, I'm going to have to leave you. I do apologise.
okay, thank you very much, Dr. Smith, for attending.
Thank you for having me. Thank you for having me.
Thanks, Magda.
Related to that question, then I'll take it over to Atul. There was a question put in the chat about there have been some deaths reported due to the Pfizer vaccine, and this has led to questions about its safety. Would you like to comment on that? I mean, is it related to the failure to disclose pre-existing conditions to a medical professional, or?
So the answer to that is, if you look at any medication, and let's regard it as a medication, if you look at any medication that we administer, there will be a risk. And the risk with these vaccines is in the region of 1 to 1.2 to a million. So the more we give, unfortunately, we will see reactions. We will see reactions. And that will follow with anything that we utilize in medicine. But there's nothing there that makes this any other way different or unsafe. And I don't know the history of any previous deaths, whether it was related to undisclosed ill health.
Thank you, Atul. I've got a question here from Lynn and Derek. Hi, my 94-year-old mother has had the Pfizer vaccine. Will the follow-up still be Pfizer? I believe that is the case. At the present time, the expert advice is if you have received a dose of one vaccine, it would be most appropriate if you receive your second dose of the same vaccine. But Atul, that is the current thinking, is it not?
Sorry, Councillor Frost, can you just repeat that?
So the questions regarding if one has the Pfizer vaccine, the follow-up will be the same vaccine. I was led to believe that that was very much the expert guidance at the moment.
Absolutely. The guidance is to use the same brand or the same type of vaccine and not to mix them. Thank you.
A question from Richard Saville. Once groups 1 to 4 have been covered by the 14th of February, what will be the prioritization for the next group? For example, my wife is nearly 70 and Mrs. is being in group 4 by 2 months. Dr. Ansell?
As far as I understand it, the JCVI have set out 9 groups, and the plan would be to work through them. So I am in the 8th group. I think I'm in the 55 to 60 group. So I believe I will be offered vaccination before the end of April. So my understanding is that the plan would be to work through the remaining groups, with the intention of getting to the end by the end of April.
Thank you, Mark. Would it be helpful, because there is a published list. The JCVI have published a list of the priority groups. Would it be? I think it'd be helpful if we did include that in any FAQs. So if we could, if the moderators could please take note of that. I'm just looking through. I have no other pre-submitted questions which haven't at least been covered. So I am just scanning through the questions that the groups of questions that have come through the chat. Because we are 5 minutes to time. I think we've covered off most of the questions that I've been directed to answer. The details of the leader and myself will be available at the end of this meeting if you have any specific questions in terms of maybe your own personal situation, which would be inappropriate to discuss in this forum. We would be happy to provide assistance if you feel that is would be helpful. Sorry, I'm just reading some notes here passed to me by the moderators. I think that they are all the questions that I've been directed to ask. I will just I will ask the leader just to give a brief closing statement to thank the participants. Councillor Wyatt.
Thank you very much, Jason. Well, first of all, I'd like to thank everyone for taking the time to attend this afternoon's session. I think things like this are incredibly important for us to be able to disseminate truthful information, accurate information, and be able to offer some reassurance to all of our communities so we can dispel any myths that have got into people's minds from the fake news that's been peddled by a small number of people in our community. I'd like to thank our colleagues from the CCG and from the NHS, as well as from Public Health, for taking the time for coming along today and answering some of your questions. If it is I think this is our first session, but I'm very happy for us to organise subsequent sessions so that people can, if there are any further questions from people that are unable to attend, for us to be able to organise that. I'm sure that Commons will be able to put that in place in due course. If you do have any questions, as Jason said, either email myself or Jason, and we'll do our best to be able to answer. So thank you very much for everyone for attending. I believe our details are in the chat box below if you'd like to see them. So thank you and stay safe.
Thank you, everybody.